Many patients are afraid of bringing this topic to their doctors. They are afraid of being judged, criticized, and stereotyped. Opioids are the most powerful painkillers, and there are still many people who use them for pain management. The goal of this video is to help patients with chronic pain approach their doctors in a safe manner and have an open discussion about opioids without being judged as a drug seeker. A few decades ago, doctors were persuaded to prescribe opioids to anyone with pain. Now, they are being pushed to stop prescribing opioids for pain. No wonder there is a lot of confusion, mistrust, and lack of skills out there. But patients are caught in the middle of this opioid crisis with a serious problem. If they are receiving opioids to manage their pain, what should they answer if the doctor suggests stopping their opioids? How will that conversation go? Or if they are not being prescribed opioids and they are in severe pain, what should they tell their doctors to initiate a trial of opioid therapy and test if they are responsive to this type of medication? So let's talk about talking about opioids with your doctor today. Before I continue, let me remind you that this video is not intended to replace medical advice. It is for educational purposes only. If you need medical advice, contact your doctor, and in case of emergency, go to the nearest emergency department or call 911. If you had been receiving opioids for chronic pain, your body is pretty much accustomed to them. That's what we call physical dependence. And your body does not like when you miss a dose of opioid. That's what we call withdrawal symptoms. All that your body knows is that you need these opioids to keep a sense of normal life. Even if you still have pain, but you know how you feel when you skip a dose of these powerful painkillers. Now you're worried because your doctor has suggested that they will not be able to prescribe your opioids anymore. This may be because your doctor will move to another place, will retire, or just decided that they will not keep prescribing these opioids to you anymore. What can you say at your next appointment? This appointment will not go easy, and I advise you to get prepared for this difficult conversation. I had been in that situation myself many times when I had to inform a patient that I was not going to prescribe their opioids anymore. And I had reasons for tapering and stopping that prescription. If you want to hear my approach to this conversation, watch my other video about opioid tapering. In that video, I explain what are some reasons for tapering opioids and what are the challenges in managing withdrawal symptoms. I'll put a link to that video in the description below. But today, I'd like to guide you on what can you do to prepare yourself for this conversation. First, remember that you are responsible for what you say and what you do. So do not say or do anything that you will regret later, like being rude or impolite. Second, explain the reasons why you had been taking these opioids. Talk about your symptoms before you were put on opioids and what changed in your life after you started taking them. Are you able to function better, go to work, clean your house, take care of your family, volunteer or study? If opioids have helped you to function better, your doctor could help you to find another person that will continue prescribing for you, like another family doctor, a nurse practitioner, or a pain specialist. Third, talk about any previous attempts to reduce the dose of the opioid or to stop taking them. What happened and how was it done? Did you try to stop cold turkey? Did you try a slow taper? Did you try medications to manage the withdrawal symptoms? I see many patients who tried to stop taking their opioids without any medical help. They went too fast and did not know how to manage the withdrawal symptoms, and their experiences were not pleasant. And that's why they don't want to do that again. But it doesn't need to be like that. There are effective, slower methods to taper opioids. Fourth, if the dose has to be reduced, ask about a plan to manage the withdrawal symptoms, how you will get help if there are intense withdrawals, where should you go or who should you call if there is a need. Is there a nurse, a pharmacist, or a clinic staff that you can call? How long it will take this tapering? You may ask for a slow taper. You may ask for a pause in the taper if the withdrawal symptoms are too hard on you. And you can ask if there is another substance that you can take to help you manage the withdrawal symptoms, like insomnia, abdominal pain, headaches, tremors, and profuse sweats. Fifth, if possible, try to get a second opinion with a pain specialist before tapering and stopping the opioids. There are some interventions and other treatments that can help your pain and the need for opioids. There are some opioids also that have fewer withdrawal symptoms, like buprenorphine and methadone, and maybe the pain doctor could help you to get those medications. So now, the second scenario is different. If you have never received opioids and you have severe pain that is very debilitating for you, and you wonder why your doctor never approached you to offer opioid therapy, you would like to hear about the benefits and risks of this therapy for you. How do you open up that discussion without sounding like a drug seeker who is looking to get high on these powerful opioids? First, at your next appointment, ask the doctor if your pain is responsive to opioids. There are some pain conditions that do not respond well to opioids. In fact, that they may get worse with opioids. This type of pain is what we call nociplastic pain. And you may watch another video that I made where I explain what this is. If you do not have one of those nociplastic pains, then you may be a good candidate for an opioid trial. So second, ask the doctor to do a trial of opioids. A trial is a short period of time, usually 3 months, that the drug is tried, has a test drive. And at the end of the trial period, you and the doctor will come up with the conclusion if the trial was successful or not. Ask the doctor if they could try a low dose of opioid therapy as a trial. How do we know if the trial was successful? Well, the doctor will assess if the pain is reduced and if your function is better. If at 3 months these goals have not been achieved, then the trial was not successful, and you and the doctor will discontinue this medication. Third, you may ask your doctor if they are concerned about any risks that you have in relation to opioids. Are they concerned about addiction, opioid use disorder? Are they concerned about overdose and other complications? These other complications may be sleep apnea, immunosuppression, low sex hormones, osteoporosis, risk of falls, risk of sleepiness that could cause a car accident or an accident at work. If they respond yes, they are concerned about putting you at risk, then have a plan to respond how you can mitigate those risks, like not getting a large supply at the pharmacy at once, having a naloxone kit at home, not driving after taking these pills, etc. Fourth, ask about the maximum dose that you will be taking on a daily basis. It is important that you and the doctor agree on a certain ceiling level, an approximate number that the doctor will not prescribe above that. So you will not be surprised later if you hear about that your doctor has a ceiling dose. For example, not going on a high dose of opioids above 100 milligrams of morphine equivalents per day. Fifth, if you are a female patient and in the reproductive age, ask your doctor if there is a plan for stopping the opioids when you get pregnant, because opioids cross the placenta and there is a risk of neonatal abstinence syndrome. And last, ask your doctor what happens if they are not able to renew your prescriptions, like they go on vacation, they get sick, who will replace them, and if there is another doctor going to renew your prescriptions on time. So I hope this video gave you some ideas about how to approach a difficult conversation with your doctor about opioids. They will likely ask these questions, and it is better when you are prepared to answer them. And remember, the doctor is responsible for the prescription they write, and you are responsible for how you use these medications they prescribe. So you are partners in this journey. I wrote a summary of these points, and you may download a document. I put a link in the description of this video below. So check the description of this video below to download a document containing the summary of these points. If you like this video, press the thumbs up button here. Don't forget to subscribe to this channel and turn on the notifications so you can be alerted when I post new videos here. And watch my next video here. Thank you for watching. Goodbye.